Greetings, my IDD subscribers. Last video I said I would talk about disc anatomy and pain mechanism, but I've decided not to, and I've decided to talk about something very important with specific lower back pain, something called functional information. So with provocative discography, the surgeon is going to insert a contrast into one disc at a time. The disc that has been injured or has internal disc disruption, when the contrast or dye is inserted into it, it causes pain, provocation. So this is a pain response. This is functional information. Afterwards, the surgeon will send the patient for a CT scan. There's the disc in normal position, and on the CT scan you will see the tear of the disc. That is what you see on the CT scan. With dual diagnostic blocks, the surgeon would have injected facet joints, SI joints, and found the spot where the lidocaine, after the anaesthetic has started to work, takes the pain away. The pain then comes back after a while, and then the specialist puts bupivacaine, this time, into the same spot, and after a little while the pain goes away, giving functional information. The surgeon knows exactly which spot to inject with these two anaesthetics. Now, with specific lower back pain, you might have a disc bulge. That may or may not be the cause of your pain or loss of function in the leg. The surgeon has to correlate that exact nerve with a loss of sensation, a loss of reflex in the leg, and a loss of motor or muscular mechanical function in the leg. If there's a correlation with that loss and the nerve being pressed, clinical diagnosis can be made. Even with a CT scan, you might see internal disc disruption, but that is not a definitive sign. That's not a definitive diagnosis. You need the provocative response with this to make a diagnosis. The next talk will be about disc anatomy. Thank you for listening.